from one bad story to another bad story. This is just absolutely insanity. So just hang with me here. Hang with me here. So a German male nurse has been suspected of killing 84 plus patients. What? Yes, 84 patients. How did he get away with this? How did it happen? Let's find out. So a former German male nurse is suspected of killing at least 84 patients by injecting them with lethal drugs. Niels Hoegel, 40-year-old male, was jailed in 2015 after being convicted of killing 6 people. In past hearings, Hoegel admitted to injecting patients with a drug that can cause heart failure and circulatory collapse, so he could then try to revive them. He said he felt euphoric when he managed to bring a patient back to life and devastated when he failed. That is the most selfish, disgusting explanation as to why you would put someone, you would risk someone's life. So you can have that euphoric feeling of bringing them back when you're the one who put them in that situation. It truly is a psychopath. This is insanity. So this happened. So this was in 2015. Those 6 people, and he did admit to, yes, I would give these people injections, and then they would, injections of a lethal drug, get them under circulatory collapse or heart failure, do a CPR, try to revive this patient, and oh my goodness, I'm the hero. This is some crazy, like, Joker, insane nursing type crazy shit. It's insane. It's just insane. So, police told CNN they believe Hoegel killed 36 patients in Oldenburg between 1999 and 2001. Oldenburg is just a city, a town in Germany. And another 48 people from the hospital in Delmenhorst, which is also another town in Germany where he just went from one clinic to another. Police say the number of victims may be even higher, but the final number may never be known, as some possible victims were cremated. So from 1999 to 2015, this man was injecting people with lethal drugs just so he can revive them, so he can get the glory, right? And in that time, right now we're at 80, 90 people. So that's 5 people per year that he was doing this. And I'm guessing in the beginning it started slow. And then towards the end he got crazy and started doing a lot of them. The only reason he was ever caught is because another co-worker, another nurse, saw him injecting the men and were like, what the hell are you doing? They took him to court, and next thing you know, he's in jail. It blows my mind, because I know where I work, we have the Omnicell, we have a check, we have pharmacists. If I take out too many Tylenols, they call and they say, we're missing 4 or 5 Tylenols. They do this every single day. I understand from 1999, but it took till 2015 for them to notice. This is crazy. At 2 different hospitals, this is insanity. This is, of course, he is the problem. He is the psycho. He's the craziest person on the planet. And I know heart disease is the biggest killer around the world, right? So for someone to die from a heart attack, or someone to die from circulatory collapse, the number one question is not who did it. The number one question is, like, this is sad. And he wasn't, obviously, because it lasted that long, he wasn't stupid. He wasn't doing this to people who came in with a broken leg. Next thing you know, they die. Maybe, I don't know, but for him to have done it that long, I'm guessing he wasn't stupid. So all of these patients he was doing it to must have had some kind of cardiac or circulatory issue, right? But still, that does not leave it open for the pharmacists, the doctors, the other nurses around him, everybody else, his case manager. I mean, there's 1,000 people that work with each patient. No one noticed in his 15 years, 16 years of just literally putting these patients in, like, cold blue situations just so he could feel euphoric. No one noticed that this was a little insane. Mind you, I haven't worked in a hospital in any of those situations, so I don't know how it is. I don't know how often these things happen, but it must have been a little iffy. And I think the prosecutors have literally the same concerns I do. They stated the killings could have been prevented if the people responsible at the time, and I stress at the time, particularly at the Oldenburg clinic, but also later on in Delmenhorst, hadn't hesitated to alert authorities, for example, state prosecution. So they're saying themselves, if someone there, if the other nurses, if the doctors, if some of the pharmacists, if someone that was noticing some mishap between when he would take care of patients and all the times that he would do this crazy CPR and bring these people back to life, it would have been noticed and been like, okay, we could stop this because this is getting a little ridiculous, right? It's getting just a little bit ridiculous. This is absolutely insanity. I think it's horrific. It is the worst kind of killing. People come to the hospital to be saved. For someone to be that disgusting, to be that selfish, to be putting other people in life or death situations just so they could get the euphoria of saving them is it's too much. He needs to be in an insane asylum. Throw the freaking book at him. He is already in life in prison, but my God, even for those people that survived, for him to have done CPR or whatever the hell he had done, hit him with epi, whatever he did to bring these people back to life, even those people have life. I mean, to literally be dead, to literally go into circulatory collapse for someone to bring you back, that's enough trauma that could, be with you for the rest of your life. This man is crazy. This man is insane. This man is psychotic, right? But we do need to look at the bigger picture. The pharmacists, the people, the healthcare providers around him, I don't want to say are responsible. They're not responsible, obviously, but I do believe this kind of situation should not have been continued for this long. Should not. I mean, it's scary, it's insane, but that's the situation. This is insane. It's insane shit.